Hello, I'm Timothy Baird, Managing Editor of the American Journal of Medicine, and I'm here today with Dr. Joseph Alpert, our Editor-in-Chief, to talk about an article in this month's issue. This article, you don't typically think, Dr. Alpert, of problems with the male breast, but this article does talk about male breast issues. What would you like to say about that?
Yes, Timothy, this is a very interesting article. When I first heard about it, I thought, breast cancer and breast problems in males, that must be as rare as hen's teeth. But it turns out it's more common than that. It's almost 1% of breast cancers are in the male. And once I read this article, I said, this is really important information to get out to our audience and our readers. It turns out, of course, that breast cancer in the male is just like in the female. It can metastasize, it requires the same chemotherapeutic regimens, and it can be just as fatal and just as disabling. This article talks about all of the ways to diagnose it, both from the physical examination, usually a nodule or an area of discomfort in the male breast, and then all the imaging modalities that will enable the clinician to decide, yes, this patient has breast or likely has breast cancer and really needs a referral to oncologist and needs a biopsy and the therapy that goes with that.
This article focuses quite a bit on the imaging modalities used to help with diagnosing breast problems in the male.
Yes, well, male breast cancer can be a very nasty and fatal illness. It's something internists need to think about. When doing a physical exam, often the annual physical exam, we often don't examine the male breast. We're much more concerned about examining the female breast for lumps or areas of discomfort. Clearly, this is a wake-up call. We need to do the same thing with our male patients because the earlier, of course, we find this, make the diagnosis, the more likely that we can cure the patient either with surgery or surgery plus chemotherapy. So this is an important point to keep in the back of your mind. This is not a very, very rare condition and that it can affect males in the same awful way that it affects females.
Thank you, Dr. Alpert, and thank you for tuning in with us today. And we invite you to visit us on our YouTube channel, our website, our Facebook page, or the blog, the American Journal of Medicine. Thank you.